This was a phase 1/2 trial which was recently presented at the American Society of Haematology meeting and represented in poster form here at the Acute Leukemias 16 meeting in Munich. This trial was a study which was developed by AbbVie and Genentech, and it was utilising a drug called Venetoclax, which is a small molecule inhibitor which targets BCL2. This drug has previously been tested in phase 1 studies with a modest effect in advanced patients with acute myeloid leukemia, where the complete remission or response rate was about 19%. So because of this modest response rate, it was then taken into an elderly AML population amongst patients aged 65 and over who were considered potentially unfit for intensive chemotherapy, and was combined with a very old drug called low-dose Cytarabine, given subcutaneously for 10 days each month, and combined with Venetoclax at a dose of 600 milligrams per day. The results of the study were actually very surprising and perhaps much better than what many haematologists had expected. So traditionally the response rate from low-dose Cytarabine alone in a similar population would be about 18%. In this particular trial, the combined complete remission rate was 54%, which is considerably higher than what we had previously experienced. Furthermore, when we look at the remission duration and survival of patients that had achieved a response, at this stage the 1-year survival rates seem to be in excess of 70%, which is historically a very unexpected result. So really the critical thing now is to wait for more follow-up and to see whether these initially promising results stand up with more time, and if they do, then I think this represents an extremely interesting and encouraging advance in patients with AML who are older than 65, and currently this combination is being taken forward into a randomized study with a drug registration endpoint in mind.